Hi, you guys. This is Miss Alicia, Exam 3 review. Let's get started. Nursing interventions is big on Exam 3. So if you're dealing with a client who has loss of vision, you want to make sure that we have adequate lighting at the bathrooms, in the hallways, at the top of the steps, and at the bottom of the steps. If you have a patient who has peripheral neuropathy, a client that has peripheral neuropathy, that puts them at risk for burns and tissue injury because they may not be able to feel the sense of the painful stimuli and the temperature changes. Education to the older adult about fire safety in their home. Make sure that they have batteries and smoke and carbon monoxide detectors should be checked monthly and changed out twice a year. Baking soda, this is a star. Baking soda and a pot lid should be available when cooking. Clients should avoid using elevators if there's a fire in the building. If you get a question and it says the client makes mention that there's a fire and they're going to take an elevator, that is not right. That's not appropriate. Candles, cigarettes, and other open flyers should be avoided when using oxygen, right? The fire department should be notified if the landlord fails to address fire hazard issues on the property. We need to make sure that we review home security guidelines with our clients. So the nurse will discuss the importance of withdrawing cash in small amounts. If you have a patient that's withdrawing all their money out of the account and you know this, or when you care for them, you realize they have large sums of money, remind them to withdraw only the amount of money that they need out of their account. Clients should make sure that the doors and entryways are well lit so they can identify nighttime visitors. Also, changing the locks after noticing that keys are missing helps protect the client from intruders. And keeping in touch with friends and family daily is a way to signal to others that the client is safe. Education about internet safety. Remember that if they're posting pictures, they should be posted after they're home, right? Installing computer updates pertaining to security projects. Pertaining to security protects the client's information. Calling a financial institution after receiving an email about account verification is appropriate, and also deleting an unrecognized email is a safe action. Findings for hypothermia. Remember that if your patient is hypothermia, they're likely to be bradycardic. They'll have a decreased heart rate. Those two things are associated with hypothermia. Also, their temperature, take their temperature, and if it's under 35, they are hypothermic. Nursing interventions for falls. Make sure that we want to reduce their fall risk, so make sure that they have adequate lighting, that frequently needed items and assistive devices are near the bedside. If you have a question and it shows the wheelchair or the walker not near the bedside, that is a risk for falls, right? We want to make sure that we reduce environmental hazards such as scatter rugs and loose blankets on the floor. Also, we want to make sure that the stairways have good structural support. That means they should have banisters on both sides, and make sure that, we already spoke about that. They're reducing the scatter rugs, and make sure that they have the assistive devices near the bedside. Common problems associated with increased risk for falls. Remember that when you're assessing your patient, if they had a fall in the last year, that puts them at increased risk. Also, analgesics, pain meds put them at increased risk. Sleeping meds put them at increased risk. If there's somebody with an overactive bladder, that puts them at increased risk for falls as well. Manifestations of delirium. You will have to decipher between delirium and dementia. And remember that delirium is a disturbance of consciousness that develops over a short period of time and may be attributed to a medical condition, right? Could be infection, could be a couple of things, but remember delirium is a short period of time, and that memory deficits may also occur. Clients who are hearing impaired, make sure that our older adults who are hearing impaired generally, they experience hearing loss and sounds at higher frequencies. So it's important for you as a provider to know how to speak to them. So therefore, the nurse will speak to them in a low tone, right? When you're speaking to the client, not high pitch, but a low tone. And make sure that the television should be turned down. It's always appropriate to ask them and polite to ask them, is it okay to turn down the TV? Then that way you can hear better and they can hear better, and that you can communicate better. Interventions for the visibly impaired. Appropriate suggestions for home interventions for a client who is visually impaired includes audiobooks, right? That would be a good intervention for them. Also, like large button telephones, right? And using voice test messaging. That is good for them as well. Remember that recent medication changes may be responsible for a delirium the client is experiencing. So if your client is experiencing delirium, it would be good to assess their medication or ask the family, have they been put on any new medications? Cognitive and behavioral changes in dementia, like memory impaired with loss of the ability to recognize a familiar person or objects, is a sign of dementia rather than delirium. The key word here is they cannot recognize a familiar person or object. That is a sign of delirium. Also, techniques that the nurse should consider using when working with an older adult who is confused. Make sure that you keep them on a routine. They have rooms. Keep them in the same room, and they have caregivers should remain consistent. So if they have a tech that's been working with them, those patients should keep the same tech, same nurse if possible. And remember that reminiscing can be reassuring to your patient and can confirm identity for older adults who are confused. Nurse implementation to improve the mood of a client with dementia. Music therapy is a really big deal. It's beneficial in improving the client's mood with dementia. So maybe ask your client, like, what music do you like? And maybe look it up on their phone or your phone to kind of help your demented patient. What is expressive aphasia? It's the inability to express themselves fluently. If you have a question and it says that you can tell that the patient can understand what you're saying, but when they speak, it's hard for them to speak what they're trying to say. That is expressive aphasia. Remember that if the older adult is experiencing pain or discomfort, then the depth and knowledge gathered through the assessment will suffer. So if your patient is in a lot of pain, you want to take care of the pain before you finish your assessment. Older adults with strong self-esteem, right? They have personal values and they believe that they have control over their lives. They are generally received positive feedback and have had positive life experiences. A strong sense of self-esteem could help an older adult overcome the influence of ageism. Who is at greatest risk for suicide? When the people express feelings of sadness, hopelessness, despair, and grief, assessing any possible risk for physical harm to himself or herself is important. If a patient tells you that I want to go to heaven with my wife, they are at risk for suicide. Positive ways to deal with stress, right? We want to make sure that we encourage them to go to bed early to ensure adequate sleep control and improve the client's health, but it doesn't directly address his request. Right? Before trying pharmacological agents, make sure you try non-pharmacological stuff. Exercise may reduce excessive levels of stress, so they are related to like hormones, and they may allow the body to regain homeostasis. Make sure that when you're encouraging them to exercise, that it's stuff that they can physically do, right? We don't want to encourage something like running a half marathon, and that alone will stress them out as well, even further. Remember, older adults are at an increased risk for depression. So if an older adult says they have a hard time, or a family member says they notice that their granddad, mom, or dad is having a hard time making a decision, that is a sign of depression. The coping mechanism of substitution is a busy activity for the process of confronting grief. So there's a question saying something like the patient wife died 2 years ago. Since then, he works nonstop to avoid going home. That is the coping mechanism of substitution. Massage in the older adult relieves the pain of chronic conditions like rheumatoid arthritis. How to avoid social isolation? There's a couple of ways, but as the nurse, you should make sure that there's one-to-one interaction, even for brief intervals during the day. Helps the person maintain some social contact. The following age-related changes can mimic the signs of substance abuse in older adults. We're talking about altered sleep pattern, falls, memory loss, and confusion. The mini-cog is an instrument that screens for cognitive impairment, often found with dementia. The result of an abnormal drawing of a clock indicates cognitive impairment. If you see a picture and it's supposed to be the mini-cog and the clock does not look like a clock is supposed to look like, right? That is a sign, right? That is a sign that they're having some cognitive impairment. Remember that for many Indians, health and spirituality are inseparable. So if you have a patient who is an American Indian, remember that they combine health and spirituality together. What is sundown syndrome, right? What is that? And that is when the patient gets agitated and confusion and it worsens later in the day. Nursing interventions appropriate for an older adult experiencing anxiety and fear, right? We want to encourage them to verbalize their thoughts and feelings so that they can better cope with their fears. Also provide a pleasant distraction and identify coping strategies that worked in the past and are also effective interventions for older adults with anxiety. What is the best way to provide culturally appropriate care to patients? And as the nurse, you're going to make sure that you ask the client what their cultural preferences or beliefs that affect healthcare. What are they, right? What are your cultural preferences or beliefs that affect healthcare? It is important for the nurse to consider when caring for older clients, the sexual needs do not disappear, right? Just because they're older doesn't mean that they don't have sexual needs. Also, an older adult client's sexual desire does not diminish. It does not go away because they're older. The need for intimacy does not decrease. They still want to be intimate, and the importance of sexual intimacy does not decrease. Dyspareunia. This is when they have discomfort associated with sexual intercourse related to menopausal changes A lot of times for women, this is due to like vaginal dryness. So as a provider, you can encourage them to get an over-the-counter water-soluble lubricant they can safely use to reduce the discomfort of sex. Erectile dysfunction, right? Remember that herbs like ginseng and ginkgo are reported to have an aphrodisiac effect and can improve the symptoms of erectile dysfunction, but this has not been clinically verified. So remember that these herbs can have dangerous interactions with other medications. Also, a calcium channel blocker is a classification of medication that causes sexual dysfunction. So if your patient is complaining about having some erectile dysfunction or sexual issues, you can always assess their medication and see if they're on like a calcium channel blocker. Sexually transmitted infections in older adults are a big deal. These older adults are getting STIs, and the incidence of HIV is rising faster in adults. So we have to make sure that we're educating them. Remember that their immune system is slowed down, and this makes the older adult more susceptible to contracting HIV. If an older adult is acting sexually inappropriate in a public area, you as a provider should give them privacy, right? Put them in a private place so they're not having those sexual acts out in front of everybody. If the patient is confused, it's not done on purpose, right? When they're confused, they're not going to understand that what they're doing is inappropriate. So just provide them privacy. Complex grief is losing the ability to perform basic activities of self-care. And if you have a question that says that, like the patient says they don't want to get up and take care of themselves anymore, wash themselves and clean themselves, that's a sign of complex grief. Also, when assessing a patient's spirituality, you want to ask open-ended questions all the time. It provides a foundation for future discussions. Cultural awareness, that is an appreciation of knowledge of the unique features of a cultural group. Cultural competence is a set of behaviors that includes understanding the impact of cultural values and beliefs on the human experiences. Eustress is the positive stress, right? Such as stress experienced from an exciting event or a positive change. Reminiscence is reviewing life events, especially those that are positive and meaningful. A visual disorder that causes loss of central vision is macular degeneration. If you have any questions, please make sure you send me an email.